Hello, I'm Dr. Simon Stern, consultant haematologist at Epsom St Helier NHS Trust and also the Royal Marsden Hospital in Sutton. I'm going to talk about guidelines in multiple myeloma in this webinar. My role is as lead for guidelines in the UK Myeloma Forum, or UKMF. You may know that the UKMF is a multidisciplinary group of doctors, nurses, pharmacists who have a particular interest in multiple myeloma, and certainly our goal in the UKMF is to improve practice in myeloma across the country via guidelines, but also general education and acting as advocates for patients. If we turn the clock back about 20 years before UKMF started working with Myeloma UK in the production of guidelines, it was about the time then that I actually just became a consultant, which shows how old I am. And in those days, practice in multiple myeloma was very variable across the country. For example, a lot of hospitals just had one consultant haematologist, and he or she may not have had particularly good training in multiple myeloma, which meant that the treatment for patients was often rather suboptimal. We also should remember that at that time we didn't have such things as multidisciplinary meetings, or MDMs, which, as many of you will know, is the meeting that we have on a weekly basis where we discuss patients individually and design treatment plans for them according to their fitness and the best available treatments. Over the years, we've produced numerous clinical guidelines on not just the diagnosis and treatment of multiple myeloma, but also other important features of the disease, such as side effects of treatment, the late effects of multiple myeloma treatment, and also supportive care. And this is where I feel that the input of Myeloma UK has been particularly helpful, in as much as they provide patient voice. So very often we'd have a direct representative of Myeloma UK on the writing group of the guidelines, or if not, then the guidelines themselves would be reviewed closely by a group of interested people from Myeloma UK. And I think that has been very much to the benefit of the guidelines as a whole. When we write guidelines, what we're aiming for is to standardise best practice across the country. So we often do a literature search to get the best evidence available, and we try and distill that into the final guideline. And as a result, we hope that if clinicians follow the guidelines, patients will be well treated and treated in the most up-to-date fashion. We also feel that the guidelines have a very good educational role, for example, for junior hospital doctors who are training in haematology, but also for any healthcare professional with an interest in multiple myeloma. Overall, I think the guidelines have been a very successful collaboration between UKMF and Myeloma UK, and I think they are well worth celebrating as Myeloma UK itself celebrates its 25th anniversary.